Good morning. Nearly 66 hours or nearly 3 days after the event, we are still dealing with a rapidly evolving disaster. Today I will update you on what we know, and I will continue to do so as the picture becomes clear. Search and rescue efforts continue at a frantic pace. Every hour counts when people are buried under rubble. To complicate matters, communication on the ground remains extremely difficult, and this is also making the collection of real-time data very, very challenging. A PAHO WHO health assessment is being finalized today. Key findings of the health risks in this assessment include ensuring surgical and medical care, obstetric and neonatal care, adequate referral of patients or the triage of patients to the right locations that can adequately address their problems, safe water, shelter, food, sanitation, preventative mass vaccination campaigns, and the management of malnutrition. We are also working on ensuring that basic primary health care services are being provided, such as the provision of tuberculosis medications and HIV treatments. Our PAHO WHO ground staff have their operating headquarters based at the medicine and vaccine storage warehouse near the airport. We believe they're better positioned to manage those critical supplies, the flow and distribution. In addition, PAHO is establishing a field office in Jimeni. This is a border town located in the Dominican Republic, about an hour and a half by car ride from Port-au-Prince. And the idea here is to serve as a bridge for the management of supplies and medical teams. In other words, this will be a bridging or staging point for emergency support. You can imagine the difficulties in coordinating fuel, food, water, human resources, and medical supplies amongst the devastation of the city. So a strategic decision taken by our director, and I think will help us more effectively coordinate the flow of these resources. We still do not know or have clear estimates of the numbers of deaths. A variety of sources are estimating the number to be between 50,000 and 100,000 deaths, but we have no confirmation. Bodies are being placed in the streets. The UN is the agency responsible for managing these dead bodies. They are collecting them and taking them to a central location where they can be followed up with families in the future. In the last two press briefings, I have reviewed in detail the critical aspects of dead body management. You can find our technical guidelines on our PAHO website. The airport remains intermittently opened and closed. All planes landing, however, must be self-sufficient. They must be capable of unloading their own cargo, passengers, and equipment, and that includes ladders for the medical teams to disembark from the plane. Roads from the border town of Jimeni in the Dominican Republic to Port-au-Prince appear to be open. Supplies are arriving by tarmac. In addition, the Dominican Republic and Jamaica have accepted and are caring for an overflow of injured patients from the country. The regional and global response has been extraordinary. Haiti is the poorest country in our hemisphere, and as I mentioned yesterday, ranks 154th on the United Nations Index. So with little government infrastructure, what little infrastructure existed has been wiped out. Therefore, external support that is well managed and well coordinated is absolutely essential in these early phases. In the Americas, at least 13 countries have confirmed the deployment of medical teams. In addition, 6 countries have sent search and rescue teams. Many PAHO WHO countries are also providing food, funds, and supplies. Others are waiting reports on the assessment of needs so as to best direct their resources and support. Countries in our region recognize that this must be a regional response. Haiti is everyone's neighbor. No one country alone can conduct the response. We must do all our parts. Indeed, the response from our countries of the hemisphere has been phenomenal. And again, I can't stress enough how important it is for medical teams arriving to be self-sufficient. We continue to be struck by the fact that virtually every person we talk to has some story of a friend of a friend, or indeed a family member that has been somehow affected by this crisis. 2 of our PAHO national staff working in Port-au-Prince have suffered family deaths. Our thoughts and prayers are with them. Internally at PAHO here in Washington, we've been worried sick about a headquarter colleague of ours. Her husband had been working in Haiti when the earthquake struck. She only learned last night at midnight, more than 2 days after the event, that her husband had been rescued and was alive. What a tremendous relief. And it serves to remind us that almost everyone in some way has been affected by what is happening in Haiti. Again, I will repeat that at this phase of the crisis, we have 2 major concerns: the search and rescue that we've been talking about, the trapped victims under the rubble. The other major concern is effectively coordinating the health response, and here PAHO is taking a leading role. And basically, the issue is how we best use the wide range of life-saving resources and skills coming into Haiti. I would like to also repeat that the WHO PAHO guidelines on how to be a good donor is posted on our website, www.paho.org. We appreciate any response you may or support you may provide.